What was the driving force that led you to become a nurse practitioner?
I think probably wanting to expand myself. So as a regular RN, you're sort of fairly limited for your scope of practice. So as an NP, I wanted to do a little bit more hands-on. I wanted to learn more about pathophysiology and how the body works. So just that next step that I wanted to take, and that was probably the best way to do it from a clinical perspective. So I could still get that hands-on and still do the assessments, but I was just extending myself that little bit further. Yeah.
What does your role as a nurse practitioner involve from day to day?
So depending on what shift you're working, whether it's a morning or an afternoon or the weekend, because obviously we do shift work mostly in ED. In other places, they'll have different shifts according to how they run their wards. But we would basically either hit the ground running and start seeing patients, or we would maybe stock our areas and check to make sure we've got everything that we need. So we pick up our patients usually from once they've been triaged, and we would get an allocated patient load as people are coming through, what might be appropriate for a nurse practitioner to see, and we would start seeing those in order of being seen. Then we work in mainly a fast track area, and we would see mainly the minor illness and injury type patients. So, and then we would see them independently and discharge them hopefully home if there's nothing wrong, or they just need some minor management. And then from there, we may be required to sort of work in the department as well. So we do a mixture of mainly our own patients, but we're also on the floor helping out other staff. So we do a lot of education with the other nurses and also the other doctors. If they need hand resus or they need hand putting a cannula in, all those little things we're called upon all the time to do. Yeah.
How does your role as a nurse practitioner differentiate from the role of an RN?
I guess probably with scope of practice, as we mentioned before. So just your ability to do more clinical procedures, to work more independently. So we've got the ability to prescribe our own drugs, and whilst we work in a fairly a limited formulary, we've got a list of drugs that we can use. Our list is humongous, so we've still got the ability to manage all sorts of patients. We're not really narrow in what type of patients we can see. But we do have a list of patients that we primarily see, but we can expand on that as we need to. So yeah, prescribing drugs, ordering diagnostics, so ordering x-rays and pathology, we do that a lot. And then, yeah, the education part as well. So we often can do more education-wise because we're sort of that extra floating staff member as opposed to maybe a clinical nurse specialist or clinical educator, which is often got a patient load, and it's always hard to try and help the other staff if you're busy. So,
yeah. What kind of education and training did you undertake to be able to practice as a nurse practitioner?
So I did, in order to get registered with AFRO, you have to do a minimum master's level tertiary education, and it's changing. So it used to be that you did a general masters of nursing, and then you would go and do an interview with the nurses board, and they would interview you about drugs and clinical management and your assessment, and that you know what you're doing. Whereas it's sort of changed now, as a lot of universities are offering a specific nurse practitioner masters, and that process becomes a part of your course. So once you've completed that masters, which is what I've done, the process then to becoming a registered or endorsed nurse practitioner is fairly straightforward. You don't have to go through a major interview. You just need to prove what you've done as part of your coursework that meets that same criteria. So you do your masters, and then your hospital where you work also needs to agree to support you. So you have a mentor, you find education, so you talk to pathology staff, and you get tutes from pharmacy, and you have to source some of your own education to fill the gaps to do that next level of pathophysiology and assessments. So, yeah, there's a lot to do.
Yeah. What is an example of a challenge faced when you have been working as a nurse practitioner?
So probably the feeling like you've got gaps in your knowledge would be the biggest thing. And often you don't know what your gaps are until you're in front of the patient. And everything seems straightforward when you get your triage card and it says, query sprained right ankle, and you get there and you think, oh, is it a fracture? Is it edema? Have they got a cellulitis? You're just constantly thinking, what else could it be that's far worse than just a sprain? So you're really sort of overthinking everything, making sure that you've considered all your differentials that things could be, and worrying that you've missed something is probably the most hairy part of being in this pack. But in emergency, you're surrounded by qualified staff all the time, so you're constantly asking questions, and you've always got the ability to double check with someone. So that's probably the biggest challenge I feel, is that feeling like I don't know enough or missing something, and so making sure that I'm asking the questions and filling the gaps in my knowledge as well.
What do you enjoy most about being a nurse practitioner?
Probably the autonomy, so being a little bit independent with what I'm doing. Definitely being that hands-on, so all the clinical procedures that you can do as a nurse practitioner that you can't do as a normal RN. So, getting your hands dirty with doing sutures and plastering, helping in putting in central lines and art lines. What else do we do? Often, because we're at that level, we get called upon by our ED consultants who manage the medical part of the ward. So they involve us in things like limb reduction, so shoulder relocations, hip relocations, putting in lines, helping with pacing. So there's lots of other higher skill things that we get involved in, just because we're then at that level where we can participate a bit more. So it is fun to sort of get involved with all of those extra things, and you learn so much more once you're sort of in amongst it, and you can be hands-on. Reducing fractures, it's creepy, but feeling that fracture underneath your hand as you reduce it, it's weird, but it's sort of enjoyable, because you can feel things lining up, and you've done the job. So all that hands-on stuff, it's a weird nurse thing that I love.
Yeah.